Imagine waking up in the dead of night to the sound of voices. Not your thoughts. Foreign, chaotic voices warning you of impending doom. Today, you might seek out a therapist. But if you experience this in the ancient world, your doctor was a priest armed with a bone drill. Archaeologists have unearthed thousands of prehistoric human skulls featuring perfectly round, deliberately carved holes. The most terrifying part? The bone around these holes shows signs of healing. These patients survived the procedure. It's a practice called trepanning. Without modern medicine, prehistoric societies assumed chaotic behavior meant a literal demon was trapped inside the patient's head. The logical solution? Drill an exit door. And this wasn't a localized phenomenon. Ancient Peru, Greece, and medieval Africa all independently decided that carving a hole into a living person's skull was peak psychiatric care. The hand of the gods. As human civilization advanced, the physical bone drills were swapped out for divine accounting. In ancient Babylon and Assyria, suffering from severe anxiety or hallucinations meant you had broken a cosmic contract. You had angered the gods. They called it the hand of a god doctrine. The crushing weight of a panic attack was interpreted as the literal hand of a deity pressing down on your chest. Therapy involved a forensic priest cross-referencing your nightmares against massive clay databases of sins, trying to figure out which god you offended and what ritual could buy back your sanity. The sleep temples. But cross the desert into ancient Egypt, and history takes a wild turn. Around 1550 BC, Egyptian physicians began treating emotional disorders not as demonic curses, but as legitimate medical conditions. If you suffered from severe mental distress in ancient Egypt, you might be prescribed incubation therapy. You would be taken to a tranquil, garden-filled temple dedicated to the healing god Imhotep. You were prescribed music, calming environments, and therapeutic sleep to soothe an agitated mind. If you love uncovering the hidden, bizarre history of human biology and psychology, hit that subscribe button. We decode the past every single week. Weaponized madness. Ancient Greece introduced a brutal ideological split. The philosopher Plato argued that madness was a superpower, a divine state where the gods spoke directly through you. But the physician Hippocrates slammed the brakes on that theory, arguing that mental illness was strictly biological, caused by an imbalance of body fluids like black bile. Rome inherited these medical frameworks but did what Rome does best: weaponize them. The Romans created a legal category called furiosus. If a person was declared mad, they lost all legal rights and their property was seized. Crucially, this diagnosis wasn't made by a doctor, but by the patient's family and a local magistrate. If you had a wealthy uncle and a lack of morals, having him legally declared furiosus was a highly effective, state-sanctioned way to steal an inheritance. The Forgotten Golden Age. When we reach the Middle Ages, the standard historical narrative claims everything devolved into demonic exorcisms and witch hunts. While that happened in Europe, it completely ignores the Islamic Golden Age. In 1025 AD, the physician Ibn Sina wrote The Canon of Medicine, identifying conditions that perfectly mirror modern depression, OCD, and anxiety. The Islamic world didn't just theorize. They built the first actual psychiatric hospitals in human history in Baghdad and Cairo. These weren't prisons. They were therapeutic healing centers, with running water, gardens, and active physician oversight, centuries before Europe would catch up. The 700-year miracle. But medieval Europe did have one shining, almost unbelievable anomaly. In the 13th century, the town of Geel in Belgium established a community foster care system for the mentally ill. Pilgrims seeking psychiatric healing would arrive in the town, and local families simply took them in. They ate together, worked the fields together, and integrated these suffering individuals directly into daily life. No chains, no dungeons, just radical community inclusion. And the most staggering part? The town of Geel is still doing this today. A completely unbroken, 700-year-old tradition of community mental health care. The human zoo. Unfortunately, the rest of Europe took a much darker path. By the 17th century, the modern solution to mental illness was mass confinement. The most notorious was Bedlam Royal Hospital in London, better known as Bedlam. The conditions were so catastrophically unhinged that the hospital actually charged public admission. For a small fee, Victorian families could visit Bedlam on a Sunday stroll and watch mentally ill patients suffer, treating profound human misery as a weekend freak show. Thousands of visitors poured in annually to point and laugh at the confined. The empathy gap. It wasn't until the late 18th century that reformers like Philippe Pinel in France and William Tuke in England physically struck the chains off patients. They introduced a radical new concept: treating traumatized people with fresh air, dignity, and kindness actually produces better medical outcomes than torturing them. When you trace this massive timeline, from prehistoric bone drills to the sleep temples of Egypt to the horrors of Bedlam, a chilling pattern emerges. The most humane treatments rarely came from the most technologically advanced societies. They came from communities willing to look at a person in profound, uncomfortable distress and say, "You are still human, and you still belong here." Science can give us the diagnosis, but humanity dictates the cure.